Hello, welcome and thank you for joining us for tonight's session on Specialists and Referrals using Healthlink smart forms within Genie. My name is Bradley and I am the Digital Health Navigator here at Central and Eastern Sydney Primary Health Network. I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognise their continuing connection to land, water and community and pay respect to elders past, present and emerging. I also extend that respect to any Aboriginal colleagues who may be joining us today. Please note this webinar will be recorded and will be available on our YouTube channel within the next couple of days. The participation evaluation survey link will pop up on your screens at the end of the webinar. We appreciate your feedback, so please do complete this to allow us to improve the program. Please also ensure that you submit your questions to the speaker in the Q&A box throughout the presentation. To view this box, hover your mouse over the toolbar at the bottom of the screen and select Q&A. So some program updates that you may be aware of. With regards to the Medicare Web Services changes, please do ensure that you check your version of Genie, as there has been a recent release on the 21st of February for Genie 9.4.6, which has also enabled further access for My Health Record for Specialists. And My Health Record for Specialists is now enabling Genie practices to upload specialist letters. So should you need any support with this, please let us know in the survey after the webinar. Also, there is a GP focused webinar on the demonstration of smart forms on the 24th of March. So if you are a GP or no GPs who are interested, 24th of March is the date for that webinar. And without further ado, please allow me to introduce our speakers. So firstly, we have Eric Dunn. So Eric is the clinical liaison for SR Referrals. And next we have Nicole Matthews. Nicole is the technical expert for SR Referrals. And finally, we have Dr. Carmel Servin, who is a part of the SR Referrals team. And now let me pass you over to Eric, who will start the webinar and demonstration. Thanks, Eric.
Thank you, Brad. So hi, everyone. As Brad told you, my name is Eric Dunn. I'll just move a couple of things around on my screen. I'm the presenter for this evening. I would also like to begin by acknowledging the traditional custodians of the land on which we meet and pay my respects to their elders past and present. I extend that respect to Aboriginal and Torres Strait Islander peoples who may be on the call this evening. A quick bit about me. I've been in information technology for over 20 years, the last 8 in digital health, most recently 4 years as the digital health manager at the Sydney North Health Network. I now help specialists and GPs with e-referrals at SR Specialists and Referrals. Tonight, I also have Nicole and Carmel from SR Specialists and Referrals to help with the demonstration and to answer any questions. So tonight, we're going to talk about the existing referral process, how we've collaborated with other businesses to make the e-referral process easy, why you should use SR Referral, why you're probably already live with SR Referral and how easy it is to get set up if you're not. Then Nicole will do a demonstration on SR Referrals in Genie and a demonstration for those that don't have Genie. A quick section on how we can help, then an opportunity to get your questions answered. With questions, please use the Q&A button at the bottom of your screen. You can open it now and type questions as we go through the webinar. Please don't be shy with questions. Feel free to type your questions as we go along, as there will be a thorough discussion at the end of the demonstration. The handouts and recordings will be sent to everyone after the event. So the existing referral processes. By the existing referral processes, I'm talking about letters, faxes, and emails. With faxes, how do you know if the whole fax went through with all the attachments. With email, how do you know if the attachments got stripped out or if it went into the spam folder? Did it even go to the right person? Referrals that go to a practice where a specialist no longer works will mean spending extra time following up and sending it to the correct practice, or contacting and finding another specialist for the patient. And where do you find the specialist? How do you find the referrals? Is it easier to just ask the GP to refax it when the patient turns up? There's a huge amount of time spent scanning paper documents, both at GP practices and specialist practices. Attaching scanned documents to patient information in the clinical system, following up that the referral has been received, and retyping patient information. I've had clinicians express to me their frustration with the time spent on administration, not to mention the frustrations of the administration staff. So GPs and specialists have had secure messaging systems for years. So why no e-referrals? Well, possibly because there are multiple directories. Each hospital has its own directory. There are paper directories and online directories. There are multiple secure messaging providers. And how do you know which one's being used? Specialists move around between hospitals and practices. GPs have multiple templates for different systems, for different specialists. They have out-of-date templates that need changing or just don't work. And you have to know all of this before you even start an e-referral. So the system is unworkable. It's easier to just send it by fax and deal with the fallout from that. So what have we done about it? Servant Media have collaborated with Healthlink to provide an end-to-end solution for e-referrals, called SR Specialists and Referrals. And my next slide is coming up. There we go. I'm sure you all know about the Medical Specialists Directory, but if not, it started in Australia in 2000, and it has a listing for every specialist in Tasmania, Victoria, New South Wales, and the ACT. It is curated, so every entry is validated and up to date. It's available to you at no cost. And if you want one, let me know and I'll send you one. SR Specialists and Referrals is the electronic version of the Medical Specialists Directory that is integrated into Medical Director, Best Practice, Genie, and other clinical software, with more coming all the time. Healthlink provides a secure messaging service widely used by most general practices and specialists. Specialists with a Healthlink EDI, that's an address, can receive SR e-referrals. It is free for specialists to register for an EDI address. Healthlink have gone beyond just messaging and created smart forms that are integrated into clinical software to make the referral and data transfer process easy and secure for both GPs and specialists. Using smart forms is becoming an everyday activity for GPs, and they're currently available for hospital referrals, My Aged Care, Fitness to Drive, and SR, with more to come. So why SR referrals? Well, we have streamlined the e-referral process end to end. With faxes, the GP rarely sends the fax. Typically, it goes to the admin staff to manage. With SR, the GP sends the referral directly from their clinical software. It's instant, and the patient can be given the specialist's information on the spot. The referral contains all the pertinent information on the patient that can be directly imported into the specialist software. For GPs, they only need to look up one directory for all specialists because it's always up to date and clearly identifies the referral pathways. There is one template for all referrals, both electronic and manually by fax. It meets the requirements for GP accreditation and EPIP, and they can provide the patient with information about the specialist on the spot in a format that suits the patient. For specialists, there is less printing, scanning, and data entry. The e-referral is received instantly. It's easier to find. There is more information about the patient, which can be automatically imported into your software. As for the directory, it's easy for specialists to update your information on the directory, and the GP will see your updated information immediately. We'll show you that in the demonstration. So how to get set up? Well, you're probably already live with SR. If you have Healthlink and Genie, you are live for SR. In Genie, ask your staff to check for SR incoming letters to see if you've already been receiving e-referrals. Then check out your details in SR and let us know if you have any updates, or just contact us for support and training. If you have Healthlink and other software, and your software is compatible with Healthlink Smart Forms, then you are live for e-referrals. In this case, you can just contact us for support and training. If you don't have Healthlink, register for a free Healthlink EDI address. If you're on compatible software, then Healthlink will remote in to set up your messaging. If you're not on compatible software, then you can be set up with a portal account, which we'll show you in a minute. Once your Healthlink account is set up, we will turn on your SR e-referrals and update your listing in the directory. So let's see how easy it is to use SR. Standing by online, we have Nicole, our resident Genie specialist, and Carmel to help answer questions to show us how to check your details in SR, how to find referrals in incoming letters, how to search for referrals by patient name, how to link a referral to an existing patient, or create a new patient from the referral and then link the referral, how to on-refer patients using SR and check the delivery status of referrals you have sent. And they will also show us how the Healthlink portal works, how to log in, view and save referrals, search for referrals by patient name, and how to check your own details in SR. So over to you, Nicole.
Hi, Eric. Thank you so much. So let me share my screen and get started. So to start off with, I am going to show you how to send a referral using SR Specialists and Referrals. So you need to start off from a patient record. I have got my test patient over here. And in the top, you choose Tools, Healthlink Online, and then New. What you get is you get the Healthlink landing page, and here are all the other Healthlink smart forms that GPs are using daily. We are up at the top here, SR Specialists and Referrals, and you click on Private Specialist Referrals. Now, as I said, I am going to show you how to send a referral. And even if you don't want to make a referral yourself, it's really important to see how you are represented here on SR. So to start off with, I am just going to search by category. And I'm going to do neurology and search specialists. Now you can see I get a lot of results. I have some groups and some standalone specialists and a mix of e-refer and manual refer. Now a manual referral is done in exactly the same way as an electronic referral, but you need to print it out and fax it or email it at the end. So it doesn't get sent by Healthlink, but it's the same form right till the end. So in this case, I want to refine my search because there's too much to choose from. I am going to choose a suburb. So my suburb is Kogarah, and I'm going to hit the search button again to refine my search. So again, I get group and some specialists. So what I can do here is I can send a referral straight from the group record, and that referral will just be addressed to the group. There won't be a specialist name. Or I can click on the group page, and I can read a bit more information about what they offer, and I can choose my specialist here and then send a referral to that specialist. And that way the referral will be addressed to that particular specialist. Now what I would do is I just choose the location, and when I click on that, the referral form comes up. I'm not actually going to do that now because this is live and I don't want to send a weird referral to somebody. So let's just go through that search functionality again. So I'm going to go back to that main page. And here you can see a picture of that medical specialist directory, which is the book that we have been producing in New South Wales for over 20 years, and GPs use this to find specialists. And SR is exactly the same way, especially if you do not know the specialist you want to make a referral to. It's a great way to search and expand your specialist base. So we've already done finding a specialist by category, but what happens if the category is a little bit strange and you don't quite know how to get there? So I'm going to choose hand and wrist surgery, and I could go there through orthopedic surgery, search my specialists, and then I can choose here hand and wrist surgery as a related subcategory, which refines my results. There we go. I can also go to search again. I can choose plastic surgery because plastic surgeons also operate on hands. I'm just looking for it. There we go. Search my specialists and then refine by hand and wrist surgery. And I get the same results. And if you have a look, you can see some people are orthopedic surgeons. And then just looking at this guy is a plastic surgeon. The easiest way to do it is to type in a keyword actually. And I can just type in hand here. Click on that and search specialists, and I get pretty much the same results. Now I'm going to show you how to send a referral, and in this case I know my specialist name. So I'm going to search and I'm going to type in his last name. You can use the first name, but you generally get a better result with the last name in case there are shortenings or nicknames. So I'm going to use Mickey Mouse, who is my test specialist, and I have to hit search for Mickey Mouse to come up. So I could make the referral straight from this page here by choosing an address, and you can see I've got e-refer addresses as well as a manual referral address. Now addresses are software specific, so if there is not software at that location, it will be manual, but the specialist might be at more than one location, so there's an e-refer address there. What I am going to do is I'm going to click on that patient record just to double check which address is the one I want to go to, and I am going to now choose that address. So once I've chosen the address, I now get to the Healthlink smart form. And this smart form is very similar to the other smart forms that GPs use. So the information is laid out in a very, very clear way. So what I have here at the top, I have got the specialist details, and all this pulls through from our database. So that's from the medical specialist directory. I need to fill some of these in. Specialist referral would be 3 months. And then the patient referral, the reason, I do have to fill that in. So I'm just going to do this. I could also browse for consultation notes and copy and paste from the consultation notes. So as long as I have a reason for referral, this form is pretty much okay, this page. Now the exciting thing here is I can attach attachments and reports. So here I'm going to browse the patient record and I'm going to find the iron studies. I can click on that and I can attach. Okay, so now I can see that I do have that attached, but I can also look on my computer. And I'm just going to browse my computer because I don't know the file name and click on what I want and open and upload. So on my attachments and reports here, I can see I've got one iron studies and I've got the X-ray over here. If I'm not 100% sure that I've got the correct results, I can click that computer button and that gives me a preview. So there you go. I can see a preview of that lab test, and I can close that because I know I've got the correct one. So the next 3 sections here are all pulled through from your patient record. And this is great. It means you don't have to fill anything in. If for some reason you think something is not relevant, you can untick it, but all the medications and allergies will automatically be ticked in. And then the patient information is also pulled through from your patient record, so no needing to type anything in. The last section over here, the referrer information, is pulled through from your software. So when I have my Genie set up, I fill in all this information here, so I know that it is correct on every referral that I send. So what I'm going to do now, I can preview that referral and I can see what it looks like. It's taking a little bit longer to down quite far from the internet. Okay, there we go. So you can preview that referral and it does tell you at the bottom that there are attachments, but you don't see them at this case, at this stage. I've also got a warning that it's not been previewed. I'm going to submit it. So I hit that submit. Obviously, I don't have to preview. If I'm happy with it, I can just go straight to submit. So this takes a second to go through, and at the top, I have got a message on this PDF document. And this message tells me that the referral has been sent and acknowledged with a timestamp. I also have the referral ID here, which is unique to every referral. So this PDF or this document is now unalterable and it is in your patient record. So it's been saved. So what I'm going to do now is close that. And I'm going to show you where to find the referrals again. So I go to Tools, Healthlink Online, New, and there's the landing page. But if I go back, I get a record of all the Healthlink correspondence that has been sent from this patient record. And this is great because I can now look and see what I've sent. So this one here, this very top one, is the one I sent a few minutes ago. I can view it and I can see it's there in the patient record. Okay, so I'm going to close that. What I do have is I can see here that that form is form submitted. So we are waiting for an acknowledgement. The majority of my referrals have been acknowledged. And in this case, it means that the receiver software has acknowledged that they've got it. Again, it doesn't mean that somebody's opened it and read and processed that referral, but the software has sent back a little acknowledgement saying that the referral has been received. Now, some still say form submitted, and technically we are waiting for an acknowledgement. But not all software acknowledges. So what I would say, don't worry about the ones that say form submitted. Look out for anything that says error, and then you know you need to resend that referral. Now this one here says form submitted, but there's a PO next to it. And over here, it's an application PDF. And what this means is that PO means that it wasn't actually sent electronically. The form was done through Healthlink, through the Healthlink smart form, but it was sent manually. So I can double check that by seeing the top of this manual referral. I have got my note here. This referral is to be printed and sent by fax or email. And it's got the fax number highlighted to make it really easy. So that is where I would look for all the referrals or all the electronic correspondence that has been sent by that on that patient record. But I'm guessing you want to find out where to find referrals. So for a specialist, that's a good thing to know. You go to Open, Incoming Letters, and here are your incoming letters. Now, this is often sent to the doctor, set to the doctor as a default. And that is me, my test specialist is Mickey Mouse. But we recommend setting it to all. And that way, sometimes Genie will make a new folder if a specialist or a referral letter comes in addressed to a specialist with a different name. It can be a totally different specialist, or it could be that Mickey Mouse was spelt incorrectly. So if we set it to all, everything will be here. And as a default, only unlinked show in the incoming letters. Now, what this means is all these unlinked referrals or all these unlinked letters, because they can be letters as well, need to be actioned. So the first thing I'm going to do, I'm just going to see if I can put, yeah, I've got the newest one on top. Okay, so let's double click on that letter and see what it is. So here I've got referral letter, but I have not got any matches here. So Genie will try to always match by name, date, and date of birth and Medicare number. And I can see there's absolutely nothing here. So what I'm going to do is I am going to make a patient record from that referral letter. So all the information on that referral letter pulls through. I'm going to save that. And now I have a match. I've got the name, date of birth, and Medicare number are matching over here. But this referral letter is still sitting in my incoming letters unlinked. So I'm just going to link this referral letter. And what's happened next is Genie has moved on to the next patient in my database, or in incoming letters. So if I close out of that, I'm going to close out of incoming letters. I'm going to open incoming letters and just go back to my sort order. So you can see the newest one on top. You can see that Amanda Greenslade is now gone. The next one I want to show you is David Anderson. So let's double click on him. Now he is already in my database. Genie's done all the matching. So there's nothing I need to do there other than link this referral. So I go link, and it's moved on to the next referral in incoming letters. So I just wanted to show you, I've got a Donald Duck referral right at the top here. And I know that Donald Duck is in my database because Donald Duck is my test patient. So the easiest thing would be for me to just link it here while I'm in incoming letters. But if I go back to that patient record, I have got a notification that there's one unlinked letter here. And this is where most reception staff or admin staff find their referrals. I have been told many times that they cannot accept referrals for patients that are not in their database, because if they don't have the patient record, they can't receive the incoming, they can't receive the referral. That is not true. You just need to go to incoming letters to check. So if I click on this unlinked letter from the patient record, it takes me back to incoming letters, but it only shows me all the correspondence for that patient. And there might be 5 or 6 things there. There might be a referral and some other pathology reports, things like that. So again, I'm going to double click and link. Now, a few minutes ago, I sent a referral to myself and I sent it to my portal account. Now, I have a portal account purely for the purposes of demonstrating. But the portal account is open to all specialists who do not have clinical software, and or they do have clinical software that doesn't accept Healthlink smart forms. So here's my portal. I'm just going to log in. The great thing about the portal account is because it's run by Healthlink, the referral comes through pretty instantly. So this is the referral I sent a few minutes ago. I'm just going to double click. And here you can see the way the referral was received. And remember, we did the attachments. So at the top here, you've got the specialist information. You've got some patient information and the referrer information. So all that header is really clear with the referral ID over there. And then the reason for it, patient referral. Obviously, we encourage GPs and specialists to put as much information in there as possible because this form is a generic form, and the more you have there, the better. But the great thing now is you can see the attachments, the X-ray I attached and the blood tests I attached. And now these come through in the referral letter. So there are no separate attachments. On that original form we sent it, they do show that there are attachments, but they don't come separately like an email attachment with bits that can get lost. Okay, so what I can do now is, if you see over here, I could then print this referral out, because again, this is for specialists who do not have software that is receiving these referrals directly into the software. So I could print this out and then attach it to the patient record if I do have software, or I could save it onto my computer. And I'm just going to show you that. I'm just going to move this over a little bit because my Healthlink's in the way. There we go. Oh, sorry. So I'm going to download. And I am going to move mine onto my desktop. And you can see the referral ID is over there. And I'm going to save. Now, if I go to my desktop, there's the referral that we just downloaded from the portal. Okay, so it's all there again, nice and clear, with the attachments that you can just print out if you need to. So let's close that and let's go back to the portal. So I'm just going to go back to my inbox. Sorry, I'm always battle with this, trying to get everything here, trying to get it all in to the screen. Oh, I do apologize. Okay, back to list. So the difficult thing with faxing sometimes is trying to find the referral. Now, I have actually got a lot of referrals in my portal because I do a lot of test referrals and a lot of demonstrations. So unfortunately, my names are pretty similar. But the great thing about the portal is you can still search by last name or first name of the patient. So I have got an interesting one here. I've got Anne. And let's hit search. And there we go. I can find that referral without having to wade through pages and pages of paperwork. So I'm going to go. Sorry, I don't know why this always moves over. So there we go. Oh, back to the inbox. So the inbox is over here, but I want to send a referral using the portal. So here is the letter writer. And again, I can see some of the other Healthlink smart forms that GPs use or you use. And then if I want, I can choose for private specialists and referrals and find our service again. So even if you don't have Genie and you do have the portal, you can still go here, search yourself up, look for your friends, see how everybody looks. The downside of the portal is that there's no patient record to pull this information through. So you do need to copy and paste or type in all the patient details. So having specialist software that is compatible with SR smart forms is always going to be the easier option. So that was sending and referring in the portal. Pretty much the same as in Genie, because the form is the same no matter what software you have, just the information doesn't pull through. So to recap, to open SR and Genie, you go to Tools, Healthlink Online, New. You get to the Healthlink landing page with all the smart forms. We are the red one. Click on that. And then you get to the SR smart form where you can search. Once you choose the address, you can send that referral. And if you want to find your referral, you go open, incoming letters, and that's what you've got. For incoming letters, if you set this to linked, you can see all the referrals or the electronic messages that have been linked already. So nothing is lost unless somebody deletes it, but you have a record. So if somebody can't find the referral in unlinked and they don't think they've processed the patient, have a check in linked, and then somebody else might have processed the patient record or the letter. Okay, I think that's it from my side. Back to Eric.
Thank you, Nicole. That was amazing. Just going to share my screen again. So did you spot how to search for patients and create a new patient from the referral? That's got to be a major time saver. So get onto SR and check if all your details are correct and if all the clinic locations are set up for your e-referrals. And if I move to the next. And also in the portal, did you catch how easy it is to use it? You can get email and you can get email notifications set up. So you know when to log in and check for incoming referrals. So whatever your workflow, if you're working with faxes, storing your referrals, waiting until the patient calls, or if you call patients to confirm, we can help you integrate SR into your workflow so you can reap the benefits of electronic referrals that actually work. We provide extensive free training for your staff and are happy to contact the GPs who refer to you so they can use SR as well. Our sole purpose is to help GPs and specialists, and we've been doing it for 30 years. We're sensitive to your requirements and admin processes, and our tools will make your life easier. Feel free to call or email us with queries or for training. Let us know if you'd like email notifications set up. If you have particular GP practices that you'd like to see shift from faxes to e-referrals, let us know and we can contact them and offer setup and training. Let us know if you have any directory updates. Because the system is live, it updates instantly. So if a specialist joins or leaves your clinic, if you're changing your contact details, if you're adding or removing consult locations, or if you're doing telehealth consultations. Remember, you can update your SR information anytime. And of course, you can improve your profile. Basic entries are free, but you can put in additional information about your services or add a photo. If you choose a paid entry, it's entered in all three, the Medical Specialist Directory, SR, and ozhealthpages.com.au. So thank you for your time. I'll just hand back to Brad now and see if there are any questions. Over to you, Brad.
Thanks, Eric. I appreciate it. So we do have a few questions in the chat. So firstly, we have a question which says, who creates the smart forms? Is it the GPs or designated specialists, or are they generic?
Can I take that one? So the smart forms are, they're Healthlink smart forms. So we have the search functionality, the directory service, because we come from the directory background. And once you get to the smart form, that's all Healthlink from there. So it is a generic form that Healthlink uses across a lot of the services. And there are tweaks, obviously, for public hospitals being slightly different from SR, but it's Healthlink smart form.
Thanks, Nicole. So the next question is, how do you keep all of the information up to date? And do you rely on practices and doctors to keep this information up to date?
I'll go on this one.
Okay.
Yep. So we have been doing updating of specialist information for many years. We do a combination of proactive updating. So that's a cycle of regular contacting of the specialist practices to check details. But of course, we also have submissions coming through online all the time as well. And we really encourage specialists and practices to keep an eye, to look at the information on SR, and there's also the Oz Health Pages is our public website, and we get daily updates on that as well. So as soon as we know of any update, we're keen to get it made in the system. Obviously, we take updating very seriously because we go to print, and that enforces a real discipline on our business to try and get everything as accurate as we can at that point in time. And we realise how important that contact details are to specialists. So we're always very keen to get the exact information for each location. We drill down to the location level. We realise how important that is. Nicole, do you want to add anything around that?
We have a team of people who call specialist groups. We try to get people, as many specialists, on Healthlink as well. So we update the information, send out forms, which we can then get the Healthlink EDI. So that form has to be 100% correct before we send it to Healthlink. So we do spend a lot of time making sure everything is up to date.
Thank you. So the next question is, one of the issues I have in Genie is GP letters and referrals getting lost amongst patient registrations. Is there a way to separate this out using SR referrals?
Okay. Genie doesn't separate the referral letters from any other correspondence by color or any highlight whatsoever. If you do get an SR referral letter. If you do receive one, it will have referral letter in the title. So maybe that is a way you can do a search for all referral letters. And if incoming letters is monitored and checked frequently, you should come across referral letters in amongst all your other pathology reports and lab tests that are coming through electronically.
Perfect, thank you. The next question is, can you resend the form?
No. Sorry. The form can't be resent. It's once it's sent, it's saved in that the way it is. You do have the option of printing it out and resending it another way if they haven't been able to receive it, or starting from scratch again. It's not such a bad thing. The patient record should have all the information, and it should just be a few clicks, but it will have a different referral ID on it.
Can I just ask Nicole, so if they've sent it, but the receiving specialist says, I've never received it, can they follow up with Healthlink or someone?
Oh, they can follow up with Healthlink or with us. We do have, we have a team of people as well who call specialists who get referrals to our service for the first time, just to double check that they know about incoming letters, they know how to access it and how to manage it. We offer email notifications for people who've never checked incoming letters before and are a bit worried about missing referrals. But if a referral, we can't find it, and I'll go through, on the phone, have you checked incoming letters? Have you checked setting it to all? Because that's often a thing that the specialist name might be slightly different. Have you checked linked and unlinked? Sometimes there can be an unassigned folder that comes up as well underneath the name drop down, and we just make sure that all those are checked. If we still can't find that referral, I actually usually contact Healthlink on the specialist's behalf, CCing the specialist or the specialist rooms in, and Healthlink has 2 weeks to get that raw data and re-import it into the specialist records. And they can usually find out if there was a little bit of a problem, because sometimes there is a problem with a setting right in the beginning. And once that setting is fixed, then they won't have any problems going forward.
Yeah. So I guess because this is a new service, we're very conscious of providing that additional support to practices and ensuring that they're trained and that there's an awareness about the referrals coming through. That's obviously important, so that the GP isn't being asked to refax it.
Yeah.
Yeah.
And some specialist software was set up before this, so they might not have all the permissions set because they never thought they were going to receive a referral. And Healthlink will work through that and get the permissions correct, so they don't have problems going forward. Yeah.
That's great, thank you. So the next question, I believe, is relating to your demonstration, Nicole. It was related to you using tasks, not incoming letters. I think as you were selecting the referral and assigning it to the patient, the person has asked, is this in tasks as opposed to incoming letters?
I'm sure it is. I know that you can set tasks, but I don't have the full Genie and I've not been trained in it fully. With Genie, they told me that I could manage everything in incoming letters, so nothing was missed. I don't know how tasks are set up, if somebody else will look and assign those tasks. I'm thinking if it is that way, I'm not 100% sure, but I was told by Genie incoming letters, nothing would get missed.
Perfect, thank you. So the next one is, after you have added the new patient, is there some way of reminding us to contact the patient to schedule a new appointment?
I think that would be a reminder that would have to be set by the rooms. I, again, have never been asked that before. I'll find out, Genie, and obviously get that ready for the next webinar, but I'm honestly not sure about that because I've never had to do that.
No problem. Next question is there a way to find a linked but not booked referral? And how are you able to keep track of these if they've been triaged but not booked? So I think these may be a little bit more towards the Genie-based questions, but maybe you can answer that.
I honestly can't answer those because I don't know how the rooms are run. If you're calling the rooms, it all depends on what you do with the fax now anyway, or a letter that comes in by email, how you would keep track of those. I'm not sure how that is managed in the software, but I'm sure, because when I phone people, they go, oh, the specialist forwarded me that this morning or sent it to me and told me to call them and book them in. I haven't learned how to do that yet.
Maybe
But I
we'll take that
will,
one on
because I've
notice.
never been asked these questions before. So thank you, guys.
Yes, so the next question is, are all of the specialists listed in the directory?
Carmel.
Yep, everyone we can find out about. So we're very keen to get all private specialists listed in the directory. So if the specialist is only dealing with public patients and doesn't take private, then that's not really as appropriate for them to be in the directory. But even if they're part-time taking private patients, then they are eligible to be listed in the directory. So there's no cost for specialists to have their basic information in, and we encourage all specialists to be listed, and we're very proactive at trying to find out about new specialists. And then it's really up to the specialist whether they choose to include more information. So that's an option that's available for the ones that want to provide that service for their patients and the GPs to see that level of detail. Yeah.
There are the occasions where some specialists are not in the directory, and that is usually because they're about to retire and they've asked to receive no more referrals. And if they get removed from the paper book, they get removed from SR as well.
Perfect, thank you. So next question is, if our medical database software does not support SR or e-referrals, is it still worthwhile for the specialists to sign up for this and have a profile?
Yes.
Yes, they can always get the portal account to receive the referrals. And then I showed you the demonstration of you being able to either print out the referral or save it into what software you do have. But yeah, that's why the portal was made, basically for people who didn't have software that was compatible with the Healthlink smart forms.
And we do have quite a number of specialists that are still on fax and manual that do have their profile and all their information in the service. We realise it's a transition. You know, a lot of people are getting their heads around becoming more electronic, and we support specialists through that transition. So even those that aren't yet set up for electronic, you're still able to be fully published. We obviously publish you in print, and we do have your full information online as well. But we do have to show clearly to the GPs at the point where they're making the referral pathway that the referral is going to go through. So whether they're actually going to be sending that referral electronic, or whether they know from the outset when they make that referral whether it's going to go electronic, or whether they're going to need to fax it or hand it to the patient or do that manual referral. Yeah.
Thank you. So next question is, are specialist practices able to access a GP directory through SR referrals?
No, that's a first. We haven't been asked for that before.
Yeah.
Yeah, no, not at the moment. That would be a lot more work. Although we are obviously working very closely with the GP practices. So I would say we're building our relationships with GP practices at the moment. Our team are phoning and proactively contacting and providing training at the GP practice level. And we're also at the GP conferences that happen. We've got the one coming up in Sydney in May, the GPCE, and we were there last year, which was really exciting. So we're keen to build that relationship between GPs and specialists. And in fact, we've been running the SR service in New Zealand for a few more years. And in New Zealand, one of the requests we did have on the GP side was to include their photo in the referral. And for the ones that chose to do that, we've provided that service. And what that's done is it's helped build the relationship between GPs and specialists, so that it's not only GPs that can recognise a specialist when they go to a conference or they're in shared events together. The specialists can start to recognise GPs and see and put a face to the name of the referrals that they're receiving through. So that's been quite a valuable addition. So perhaps one day, if there's an interest for that. But yes, our goal is to help build that relationship between GPs and specialists. So if there's some meaningful value in looking at the GP side of things, then obviously we'll be open to that.
Thank you. So do all GPs have access to the referral system?
Almost all GPs. So SR Specialists and Referrals is in the main GP software. So it is in Best Practice, Medical Director, Genie and MedTech, and that covers about 85 to 90% of the GPs. Some GPs don't have software, or they've got software that isn't compatible with the smart forms. And so they're a little minority, but they still have the book which they can use to find specialists and make referrals from.
Yeah.
Thank you. And last but not least, how do we update information? I'm a specialist and mine is wrong. So how can we update?
If you're on SR, you will see the SR support number. You can just, or email, you can phone us, you can send an email. If you don't put all the information in the email, we will call you as soon as we get that email and get it all sorted for you. Yep. You could also go to the Oz Health pages and have a look there and send a message through the support for the Oz Health pages directory.
Oh, thank you. And one more question did actually pop in as we were on our last one. So can specialists use the service to refer on to other specialists?
Yes, and it's totally free to use SR for specialists to on-refer to other specialists.
Actually, on that point, Carmel, do you want to speak a little bit about the cost of the system?
Yep. So
or the business model.
Yeah. So it's free for the GPs to use this service. It's free for them to send referrals to specialists. So there's no barrier at the GP end to be using SR and to be sending referrals through electronically to specialists. And then at the specialist end, it's free, obviously, for you to receive those referrals. And if you choose to, there's a range of options basically based on size in terms of having more profile information included. And that, as we mentioned, that's a package. It covers all three of our products. We do renewals annually on that. So every year we go back to all specialists and seek to update your information. So the paying ones, obviously, will go back and check the information there. But even if you've got the free base entry, we're contacting all practices each year to confirm that information is still correct and to give you the opportunity to make updates. Obviously, not everyone replies to the contacting that we do, but that's something that we're constantly monitoring and looking for those updates on. Yeah, and that's been our business model for many years, actually, is to offer the free information and to charge for, obviously, the photo and the more in-depth information from the specialist side, but the free referral service is core to what we do.
Oh, and then can I just add that this is a Genie webinar, so I'm assuming most people here are on Genie, and SR is in the Genie software to make referrals. If you do not have software that is compatible with the smart forms, the portal is available, and that is also free of charge from Healthlink. Yeah, that's it.
Okay, there are a couple more questions now, as more have came in, which is great. So can you assume that anyone has a Healthlink or Healthlink access has SR referrals? So can you make the assumption that someone has Healthlink and SR referrals?
Yes and no.
They should do.
I'm going to jump in for sending, yes. For receiving referrals, we, as I said, we do contact rooms and we make sure that they are happy with referrals. We do have a percentage of specialist rooms who do not want electronic referrals, and we do have them turned off. So they'll show on SR as manual refer, even though if you look on the AUPD, which all GPs have access to, that's the Healthlink database, the Healthlink practitioner database, they will have an EDI there. But we do turn them off. If they say to us, we're not going to look for those referrals, we're going to delete them when we see them in our inbox because we don't want to receive them. It's just better for everybody to not have them live. So there are people who have an EDI, but they are not receiving electronic referrals. And that is a very big question I get from GPs. They email me, go, this person has an EDI and he's wrong in your thing, and I just have to go back and say, no, we have actually contacted them. They don't want them, and they might change in a year or two once they see what they're missing out. But at the moment, we don't want to upset GPs with referrals getting lost or deleted.
Yeah.
Perfect. Thanks, Nicole. So the next question highlights how much time do GPs save by using the referral system?
I've had a GP tell me an hour a day. So we know it's significant. It depends on the volume of referrals that they're sending. And it depends on how focused they are on being able to send those referrals electronically. This process streamlines what the GP needs to do and where they need to go to find out the information to send that referral. There will be some GPs that were already sending referrals electronically, but usually that will have only been to a small subset of specialists where they've got a very strong relationship and they can remember that that specialist receives referrals through this messaging system, because obviously there's different messaging systems that specialists have been using. But the majority of GPs would struggle to remember that information across a wide range of specialists. And so that's where the problem lay in terms of their ability to manage that referral process efficiently, time-wise. It also saves them having to look at multiple different sources for that referral information as well, different hospital directories and things.
Perfect. Thanks, Carmel.
Yeah.
And this looks like it may be our last question now. So do specialists see a significant increase in the number of referrals they receive when using the system?
I would say the answer to that is that the referral base is growing all the time. So this service is relatively new on the GP end as well. And our goal at the moment is to grow the number of GPs using the service and being confident that the specialists at the other end are also looking at their inboxes and clearing their referrals. So it's a two-way thing that we're managing at the moment. Once that beds in some more, then it becomes the default means that the bulk of the referrals start going through, then yes, they will see an increase in, specialists will see an increase in referrals, because it is actually more efficient and easier for the GPs to be providing that service to the patients. And so it's something which they'll be able to do more responsively to a patient's need. And so an example of that is at the moment, often GPs will send their referrals at the end of the day when they've got more admin time to go through the process. I'm sure many of them would actually quite like to be able to do it then and there with the patient, so the patient can go out of the rooms and phone and know that the referral's already landed at the specialist rooms and that they can do that next step of booking an appointment and not be waiting for, I wonder if the GP has sent my referral yet. So those practical considerations of the process make a real difference at the patient end. And anything that improves that process is going to be useful for increasing the whole way referrals are managed both at the GP and specialist end.
Perfect, thank you. So another questions came in as to how do you set up portal access for your practice? So who would they get in touch with to set that up, I guess?
They can either get in touch with us or they can go straight to Healthlink. And they just contact Healthlink either online, mention the portal account, and Healthlink will send them the paperwork to fill in, or they can ask us and we can send them the paperwork to send in, send it back to me, and I pass it on to Healthlink.
And our contact details will be available after this. So the information we send out at the end of this webinar will have all our contact details on it.
Perfect, thank you. And are any of the public hospitals using a similar system for e-referrals?
Yes.
The smart forms, the Healthlink smart forms, that I showed you when we first got to the Healthlink. Can I quickly show you guys again? Is that okay?
Yeah.
Yeah, go ahead.
So when I go out of here, closes out. Sorry about that. I'm trying to do this quickly. It never works. So when I go new over here, I get to the Healthlink landing page, and you can see here different other hospitals who are using the Healthlink smart forms. The smart form will be slightly different because obviously it's tailored to a different audience, but a lot of people, a lot of GPs especially, are using Transport for New South Wales and the Hearing Australia. So all of these forms are pretty similar and ours just is slightly different because, you know, it's got our directory attached to it.
And just to add on to that as well, Nicole, Sydney LHD are predominantly using Healthlink smart forms. So they do host webinars, which we make available on our site. So if anyone did want to attend those, you're more than welcome to as well.
Thank you.
That's good.
And the next question is, how would you recommend we market the fact that we accept e-referrals?
We've been helping specialist practices with that, and that if you have a list of GP practices that you normally receive referrals from and you'd like to see shift to doing more e-referrals, then we are very happy to proactively contact those GP practices and offer them training on doing e-referrals, and actually say such and such specialist has requested, and would you like to take up the offer of some training? So that's the whole two-way relationship thing, and that actually quite often provides that little bit of a nudge to the GP practice that says, oh, actually, maybe I should look at this now if it's, you know, someone I know is asking for it. So we're very happy to do that. And just one other thing that I just thought of that we haven't mentioned yet is that Nicole and the team are also sending out test referrals to specialist practices so that you can see how a referral comes in and know that that's what it looks like in your system and that they are working. So that's something that we do a lot of as well, as sending referrals both to GP, to specialist practices, and having those sessions with the GP practices and taking them through how to do the referral as well. And they often send them to us as a test. So we have Mickey Mouse set up, and it's used heavily by lots of GP practices. Yeah.
One of the reasons GP practices actually send the Mickey Mouse test referral is to double check that the attachments are all working. So I then just literally save it as a PDF and send it back to them. So that gives them a lot more confidence in the attachments.
Yeah.
Fantastic. Thanks, Nicole and Carmel. And the next question is it possible to get training for my practice manager on how to use this system?
Definitely.
Absolutely.
Give us her name, please. Yes.
Yeah.
We'd be more than happy to help.
And there's other software that we're providing training on as well as Genie. So it's the portal, Genie, and a range of other software. Gen2's receiving in, isn't it, Nicole?
Receiving, yes.
Yes.
But for sending, it's Medical Director and Best Practice, as well as Genie. And then there's a whole bunch who can receive. I don't have all the software, so I can tell you where to find it, but I can't show you in something like ZMed or CCOS or something like that. But they have told me where the referrals are found. So when I do call, I can say, have you checked this folder? It's the icon on the top right-hand side that's bright purple and flashing. So I know a bit, but I can't give a demonstration in the other software.
Perfect. Well, I think that's everything, unless there's any other questions from anyone else.
Looks like we're just about on time too.
Yeah. Fantastic. So if that is all, firstly, I'd like to thank SR Specialists and Referrals team for being in attendance today. It was really insightful, and it was a great demonstration of how the product works in Genie. So thanks so much for being here. And I just wanted to remind everyone that Genie have released the latest update, version 9.4.6. So please remember to check your software version and upgrade if you need to. And if you do need help setting up My Health Record in your Genie software, feel free to get in touch. So thank you so much for your help and support today, guys, and have a lovely rest of your evening. And don't forget to complete the evaluation survey that will pop up as we end this call. Thanks so much.
Fantastic.